A recent study reveals wearing masks to help prevent respiratory illnesses, including COVID-19, in part, quote, probably makes little or no difference. The study conducted by the British nonprofit Cochrane was based on 78 randomized controlled trials in multiple countries. Researchers say the results track what has been largely observed in the U.S., that states with mask mandates fared no better against COVID than those without. And joining us tonight to weigh in on this and more is Dr. Kheriaty, psychiatrist and author of The New Abnormal: Rise of the Biomedical Security State. Dr. Kheriaty, great to be with you as always. A lot to get to, but first, I want to get your thoughts on this study. I know that Cochrane is typically considered really the gold standard for healthcare data.
Yeah. That's right. Cochrane reviews are considered the gold standard level of evidence, and this was a very large review, as you said, 78 randomized controlled trials. And the results are being presented as news, and they certainly, I think, are newsworthy. But the fact is, anyone who's paid attention to that data from the beginning of the pandemic knew that prior to the pandemic, we had 15 randomized controlled trials, all of them negative, all of them showing that masks are not effective at controlling the spread of respiratory viruses. That has only been confirmed many times over during the COVID pandemic, but we're still in a strange situation where many institutions, including especially hospitals and clinics, are still requiring masking. In fact, this story just broke on social media yesterday. A young man was arrested at a Pasadena Kaiser clinic. He was going in to get an eye exam, and he was arrested by the police for not wearing a mask in the clinic. So we have this weird situation now where the gold standard level of evidence says that masks are ineffective, and we know that there are various psychological and physiological harms that masks can cause. And yet the institutions still requiring them are the ones that should be most evidence-based, medical institutions like hospitals and clinics. So it's this weird kind of upside down situations where our nation's hospitals and clinics are the last holdouts that are still requiring this intervention that has proven time and again to be so ineffective.
Yeah, it's all very curious and confusing, too. There's another study that I want to talk about, recently published in the medical journal, The Lancet. It found that immunity acquired from having COVID is really on par with the immunity that's provided through 2 doses of the mRNA vaccine. I know that you went through this and you argued for natural immunity years ago. You actually lost your job because of it. I want to get your reaction to the study and all of this.
Yeah, so it was great to see this study, again, confirming what we already knew. So a year and a half ago, I filed a lawsuit against my employer at the time, which was the University of California, where I was a professor in the School of Medicine and director of the medical ethics program. And I was challenging their vaccine mandate in federal court using exactly this argument, that because I had natural immunity, I was being unfairly discriminated against. My form of immunity was at least as good. We now know that it's likely better than the immunity conferred by the vaccine. But that was precisely the pretense that the university used to force me out of my job and to fire me. So, I was a year and a half, I suppose, ahead of the curve, but I was also a careful observer of the research literature. And at that time, back when I filed that suit, we had 150 articles published in the peer-reviewed literature on natural immunity for COVID that were all pointing in the same direction. This recent Lancet study was a very robust study confirming data that we had already seen in Israel and elsewhere. So yeah, it's nice to get confirmatory evidence, but also it's very strange how suddenly the public narrative has shifted, and it's become okay to talk about these things that a year and a half ago would have gotten you censored on social media, or in many cases forced people out of a job because they declined the vaccine with this argument that they didn't need it after recovering from infection. So for some reason, the public conversation, the ability to say these things has changed, but the science hasn't really changed. The underlying science has been consistent throughout the pandemic.
Absolutely. And so much more we can talk about. Unfortunately, we're out of time. But Dr. Kheriaty, thank you so much for coming on and for all your insights. Always appreciate it.
Likewise. Thanks.